Are the patients awake during this procedure?
Kids talk a lot. They get things wrong sometimes.
But we learn really quick. My name is Sunyu, and I will be interviewing Dr. Padar about X-rays.
I'm Dr. Sunny Patidar of Trios Health Radiology.
Hello, Dr. Patidar.
Yes.
My name is Sunyu.
Pleasure meeting you, Sunyu.
So, I understand that this here is an X-ray.
Yes, this is an X-ray machine that takes pictures of the insides of your body, but it also is a movable X-ray machine. So it takes pictures while the X-ray is moving. You can actually see things move throughout the body. It's called a fluoroscopic machine.
And I'm pretty sure that X-rays were the first things developed to see inside the body.
That's right. That is right.
How does this thing work?
Okay. So the way this works is when the patient lays down on this table, you move the camera in place of the area that you want to take a picture of. So let's say that you have abdominal pain, okay, or pain in your stomach or in the belly. Then we put the camera over the abdominal area. We push the button to take a picture, and what that does is it emits a radiation source that goes through your body, and then under here, under the table, is the cartridge, which captures the film. And then that area, that gets sort of developed. Kind of like in the old days when you took a picture and it came out on a film. This is done that way, but it's completely digital. So it's like a digital camera, but it uses radiation to take the picture.
Are there any electrical things in here?
So yeah, this is all electrical. So if the electricity's out, this machine will not work. It is 100% run by electricity, and this one actually uses more electricity than most X-ray machines, because most X-ray machines just take a picture. You can put your arm under here and it'll take a picture. What this one will do is for instance, to give you an example, if we wanted to see how your esophagus and your stomach all work, we can give you a dye called barium, and barium is something you drink, and when you drink it, you can watch the barium go through your body using this X-ray. So you can actually see it go through your entire body. Anything that can be picked up radiographically through radiation will be picked up by this. So bones are number one, but when I told you that you take that drink of barium, barium has an element in it that can be picked up by X-ray.
So how long does it take to get results on an X-ray? My dad told me like maybe yesterday that it takes like a day to get the results.
Mm-hmm. So it's a good question. The results, after your procedure's done, your X-ray's done, then these images through these tubes gets transported to the radiologist that would interpret or read the examination. Once he reads the examination, that might take no more than 3 or 4 hours once the whole process gets done. And then that report gets sent to your doctor, and then your doctor will have it pretty much by the next day. So 24 hours.
So what's this X-ray mainly used for, like?
So it's primarily used for things like if people have fallen and they feel like they might have broken a bone, they'll take a picture of it and they take a picture of your bones, right? So anything related to any bone injury, that's what it's for, as well as what we talked about is that when you give the patient the barium, which is that liquid that you drink, you can watch the abdominal system work. You can see how things go from your mouth through your body through this camera.
Are the patients awake during this procedure?
They're typically awake. In some circumstances, we will sedate a patient, and sedate means we'll put them to sleep when we're trying to do something that may cause pain. So if we are putting a needle into the patient to drain some fluid, we may put them to sleep to take out the fluid,
so
and you could do that.
Hurt.
Correct.
Any common questions that the patients ask you?
Yes, the most common question that any single patient has asked me is whether this is going to hurt. Is this going to affect me in any way? Is this going to affect my body in any way? That's the number one question that patients ask, because they come into this room and they see this big machine and they don't know how it's going to work. And we explain to them that we're going to lay you down on the table and we're going to take pictures of your body, and this camera never even touches you.
So what about pregnant women or women that may become pregnant? Should they take this?
Sure, it's a great question. So women who are pregnant, we typically try not to give an X-ray to them because the radiation can be very damaging to their baby. However, there are circumstances when we do this, and one of the circumstances is that we can put a lead shield around the mother's abdomen where the baby is, and if we need to do an X-ray of the mother's face or the mother's neck, then we can do that because the radiation there is just going on that portion of the body. But typically we try to avoid that.
So what about 3 important things that everyone who experiences this know?
Well, I think the 3 important things that anyone who experiences has to know is, number 1, that they won't feel anything. Number 2 is that there is a small risk of radiation, but it's very, very small. You get a small amount of radiation, but the benefit is that we get to see what's going on in your body. Okay? And number 3 is that this is the oldest technology in radiology, so it's very, very simple technology and it's very quick to perform.
Well, I want to thank you very much, Dr. Padar, for your time. It's been a great opportunity interviewing you.
Thank you very much. Thank you.